My name is Jean Ross. I'm the CEO and co-founder of Primary Record, and I'm excited to share some insights around what to get ready here in 2026 when the rural health transformations are taking place in each state, and what does it mean to build interoperability bridges. So, the thing I want to focus on is some of the most key teams out in communities. And I really believe that is around our FHIR and our community paramedicine programs. And in speaking to some of those folks, they have similar challenges to a lot of our care managers and care management practices in that systems are typically built for billing and not so much the navigation and care coordination piece. Case in point, this is a quote I hear from a lot of different folks is that they're charting in several different places and constantly relying on faxes and phone calls to manage these external referrals and the care around them. And so much of the Rural Health Transformation Program grants intent is how can we build that infrastructure using kind of the rural health model to figure out how to not just replace forms, but how to update those workflows and really improve coordination. Because here's really the three big problems around coordination and the funding crisis that I know a lot of community paramedicine and multiple integrated health have faced. There's these referral black holes. There's certain time that you'll have with a patient in their home. There's a handoff, and often it takes some manual work or never know how did that outcome happen. Did the home health actually start? Did the durable medical equipment actually get delivered? Because there isn't a system that can help those referrals feed back to those programs. Patient family engagement is key. Those paramedics and firefighters are doing incredible work in the home, but often out of the loop is some of those family or other extended care team members that have to be involved 24/7 in keeping up with the plan or what is happening. So if we don't have reliable engagement, then you're spending a lot of time and team and trying to avoid readmissions. And that is what's going to be tied to a lot of the performance and renewal of programs. And so that's a sustainability risk. The program cannot you cannot transition from this grant revenue model to a sustainable payer funded model until you have performance data. Well, that's problematic when you have such disparate solutions surrounding that patient experience and care coordination. So this is where I'm super excited about the rural health transformation opportunity. 95% of the rural health transformation narratives that are out there right now all speak to some degree of interoperability. And what that is saying is that they want this program to be used to build infrastructure so that the data reaches beyond just the systems, but where the care teams and families and community partners are really working together. And really, it's got to be patient connected because that is where the data needs to come together. And in these project narratives, this is being spoken to in many different ways. Some will talk about tech-enabled care transitions, data interoperability, data hubs, coordination platforms. But it's the same problem: is how do we get data moving around that patient so that everybody can be on the same page? So enter Primary Record, our team's work. We are that patient-directed hub for interoperability and collaboration. We're an AMIA award-winning patient and family-facing solution, and we can work across existing systems to create that one shared family-centered record out in the community. Because Primary Record was founded because we saw way ahead as a nurse here that's been working in healthcare for over 15 years, that there is a gap to fill that our EHRs, our portals, and our HIEs just can't seem to solve. And that is, how do we use the data to coordinate care? And what Primary Record can do to make possible for these rural health grants is we can help those teams replace this redundancy with shared real-time data. We can enable that two-way interoperability across any care setting. We close the loop on social and medical referrals, and we can produce audible outcomes so that you can prove your value of what you're doing to keep that patient out of the hospital. So case in point, this is an adorable real story just used to kind of share what the before and after can look like on a Primary Record and paramedicine program. So Randy is your classic amazing paramedic who is spending his workdays scheduling doctor appointments, loading pill dispensers, and doing tons of education to help people like Maxine be aware of their medical condition and make sure that they try to stay out of the hospital. But as usual, they got involved because Maxine's care is falling through the cracks. So there's been 911 calls for falls. Maxine does have a daughter, but she lives out of state. This daughter's tried incessantly trying to connect different resources for her mom. There's a neighbor that fills a pillbox, but no one seems to be working from the same flow of information. And most critical is that care seems to keep falling apart in between these visits that Maxine has with her care teams in hospitals and doctor's office because no one has the full picture. Because data is disconnected, so you get the neighbor that fills the pills, you have the daughter that's watching the portals from out of state. Hey, there's even these community resources like Meals on Wheels noticing things about these folks in their homes that could be vital to helping prevent hospitalization. And then you have amazing community paramedicine folks that are walking in with papers and limited info. And then you've got the cardiologists that just cut a blood pressure pill in half. So you can kind of see that everyone is seeing a different version of Maxine's health and they're not on the same page. So that's where primary record comes in. We have that ability because of the 21st Century Cures Act and this change of the system onto FHIR. We are in a FHIR-enabled system that can allow community paramedicine programs to engage that family and that client and build that team around them in their home. We can sync those portals to get the medical information. We have notes that allow neighbors to add insights and information, or those community services like Meals on Wheels to add notes, as well as AI to help surface and cut through all of this information to quickly understand what's happening and what's changing. So now Randy can enter those home where he's already on the same page every time. So if you are interested in learning about how primary record can impact your rural health strategy, please reach out at jean@primaryrecord.com. Thank you so much.